It's great to have you with us here on a Thursday night, and we begin tonight with that new warning from the CDC, and it's blunt. They are now urging Americans not to travel this Thanksgiving. With the nation having lost more than 250,000 American lives to this, and given what they've seen in just the last 24 hours, nearly 200,000 new cases, the numbers are simply accelerating too fast, and they fear that Thanksgiving will only make this worse if we all don't pitch in. We took note of this map from the New York Times showing the nation's hotspots today, the deepest red there, but you can see this virus is all across the country. And after passing that 250,000 mark, the CDC now projects that we could see 298,000 lives lost by mid-December. Governors across the country saying this is dire, pleading for the public's health. Louisiana's governor tonight saying his state is in the third surge of this pandemic. Ohio's governor reporting hospitalizations are now at a critical state, the highest so far in this pandemic. New Hampshire imposing a statewide mask mandate, and California tonight with a new overnight curfew for much of that state.
Hospitalizations are now climbing in all 50 states, nearly 80,000 patients, a new record. ICUs hit hard in South Dakota, where new cases have surged by 400% in the last 2 months, but still no statewide mask mandate.
A lot of us are just tired of seeing the negative comments from the community, the lack of understanding of quite how serious this illness is.
And tonight, about 100 of the country's biggest hospital groups out with a new ad, begging the public to do their part and wear a mask. Healthcare workers grinding through exhaustion 8 months into the pandemic.
We know every day we come into work, it's going to be one of the worst days we've had.
Ohio reaching critical hospitalization levels. California ordering a curfew in hard-hit counties between 10 p.m. and 5 a.m. Outside Oklahoma City, 13-year-old Devin Embry went from the football field to the ICU, now fighting for his life on oxygen.
Devin was one of the ones who did not want to go back to school because he was so scared of it. He wanted to play football and he couldn't do it if he stayed at home.
In Utah, retired music teacher Grover Wilhelmsen playing his beloved violin while on a breathing machine, lifting the spirits of hospital staff before becoming too ill and requiring sedation.
That was just a remarkable scene, and Whit joins us now with Pfizer, the first.
Increase in cancellations. So far, that's been outpaced by the number of new bookings. That could be a sign that many Americans plan to go ahead and travel for Thanksgiving anyway. Nora?
Chris Van Cleve, thank you. COVID hospitalizations nationwide are up more than 100% in the last month. Rural hospitals in particular are at a tipping point. Nearly 20% of Americans rely on them. And tonight, CBS's Carter Evans takes us inside a hospital in Rupert, Idaho that's bracing for an onslaught of COVID patients.
COVID is now ravaging rural America. Today, we got a first-hand look inside a small Idaho hospital, Minidoka Memorial, with just 17 beds and a staff overwhelmed.
Super exhausting. You leave here tired. You might even start your shift out tired.
This hospital doesn't have an ICU, but there are 3 beds now for COVID patients. This 85-year-old man is infected and struggling to speak.
He's pretty weak, and that's one of the common symptoms for a lot of people.
Large cities initially bore the brunt of the pandemic, and while COVID cases are increasing again, nowhere are they rising faster than rural areas. In Idaho, 1 out of every 4 COVID tests come back positive, but many here still refuse to wear masks.
Everything you do is based on the mask and the disease, and it's wrong.
When you see people not protecting themselves, what do you think?
We probably will see them someday.
The impact is being felt nationwide.
It's relentless. It's day after day. It really takes a toll.
A hospital in Topeka, Kansas, so overrun with COVID patients that some are being kept in hallways and waiting rooms until an ICU bed becomes available. The Mayo Clinic is now reporting more than 900 staff members infected with COVID just in the past 2 weeks. In Reno, Nevada, these beds are in a hospital parking garage. By tonight, as many as 40 COVID patients will be housed here. The toll is grim. 10 members of this Ohio family are infected with COVID. Deanna Gibson just buried her husband, Ben.
He beat all these health battles, and then COVID.
Back in Idaho, the fear is that the worst is about to hit.
Is there a possibility that all your beds could fill up?
So I do see that's going to happen, yes. I do see it will fill up fast.
Now, when they get a critical patient here, they already have to transfer them to other hospitals in the state. So what happens when those hospitals are full? Well, at that point, doctors will have to decide who gets a bed. And the chief medical officer at Idaho's biggest hospital tells me that could happen within 2 weeks. Nora?
Carter Evans, thank you.
And those who heal. Chip Reed, CBS News, Washington.
And we are so grateful to all of our nurses and healthcare workers. We'll be right back.
All patients here literally are fighting for their lives.
We lost about 10 patients last week, and one of them had been on ventilator for about a month. The ones that are here now, on average, they've been on a vent for about a week or so.
Denise Morning
We're getting closer, okay?
is an acute care nurse practitioner.
There was only a few times in the summer where we were really pushed to the extreme, but now for the last few weeks, we're busting out of the seams.
But she and everyone else remain at war with the virus, even as some patients begin to take a turn for the worse.
When you first have to make that declaration, what is the first thing that goes through your mind?
Please, not another one. You know, it's a prayer. It's inevitable and we know it's going to happen, but the probability of it being a good outcome is very, very low.
But most are able to fight it off.
Look at you!
And turn the corner. Ruben Romero is feeling better after 2 weeks in the hospital and says this isn't a game. I asked why.
Me dijiste que este no es un juego. ¿Por qué?
Porque esto es una cosa muy seria.
Because this is really serious, he says. This virus is not for people to be playing with. It's very dangerous. It attacks your entire body. I'm living it, he says. And it's become life for so many in this part of the state. Hospital officials in Odessa say anywhere from 35 to 40% of the people getting tested are testing positive for COVID-19. They fear becoming what El Paso has become, mobile morgues for the dead, hundreds in the ICU amid record hospitalizations, and roughly 1 in every 24 people actively with COVID-19. It's required a regional coordination like never before.
In a relatively short period of time, our hospitals have added over 600 beds.
Wow.
You give your time.
The husband who looked up and saw exactly what he'd been waiting for. Dave and Janine Ketchadorian from Bethpage, New York, started feeling coronavirus symptoms within days of one another. They both had the virus, and 2 of their children had it too. Janine and the children slowly getting better, but David struggled. He was admitted to the hospital and fought the virus for 8 weeks without seeing his family. 8 weeks in, his wife, with antibodies, was allowed in to see him. In protective gear, her husband at first didn't realize it was his wife. And then he does.
No way. That's your wife? How are you? Look at that.
He waited 8 weeks.
And he just walked like a champ. That's the best.
And their hug.
That's the best medicine you can get.
How did you do this? They did it for me. They did it. Dr. Rossler did it for me.
Wow.
Yeah.
Oh my God.
Yeah. Remember this morning we said it was going to be a good day?
And 1 week later, when he came home from the hospital, it was this. The whole neighborhood, at a safe distance, welcomed him day home. And right here tonight, Dave and Janine and their children back home together. Sending us a big thumbs up. We're so glad Dave is home, the whole family together for Thanksgiving. Good night.
Valerie McFarland Walker of Connecticut was 61. She was a certified nursing assistant who loved her job caring for the elderly. Her daughter, LaShonda, says her faith kept her going, along with her family, including 4 children, 9 grandchildren, and a newborn great-granddaughter. May they rest in peace, and may their memories be a blessing. Aaron Burnett on Front Starts.
And from the CDC this evening, an urgent plea for Americans to stay home this Thanksgiving as COVID infections overwhelm the healthcare system and test our instincts and our resolve at this perilous moment. Here's Miguel Almaguer.
With the U.S. facing a crushing wave of patients and a growing number of fatalities, tonight at this critical phase, the CDC is now urging all Americans to stay home for Thanksgiving. The unprecedented plea comes as 50 million plan to travel for the holiday.
Why was it so important for the CDC to make this announcement today?
We have been watching the cases throughout the pandemic and watching the hospitalizations and deaths and seeing the dramatic increase over the last week. We really thought it was imperative to make this stronger statement today.
Tens of millions of Americans are going to disregard the advisory and travel anyway. What's your message to them?
To please still wear a mask. We know that it helps protect other people as well as yourself.
As our nation now averages some 1,200 deaths a day in the Midwest, home to the most dire surge in the nation, 7 governors, Democrats and Republicans, are sharing the same message in this op-ed. Stay home.
It's time, folks. We do not get any do-overs here.
Minnesota is also joining a growing number of states ordering widespread closures. It comes as many continue to mourn this Thanksgiving, including Merlin Gandara.
With COVID, you can't help it. You can't be near them.
Merlin's mother, Ophelia, was always surrounded by family, but spent her final hours alone.
You go in there thinking you're going to be okay, and at the end of the day, you're not. You're not. You come out of there in a box. In a box, because that's how we're going to get my mom. In a box.
Tonight, the warning for all Americans: don't trade holidays for funerals.
All right, Miguel joins me now. Miguel, this is going to require a lot of us really to take a deep breath here and think about what could be at stake if we don't put off those family plans.
Yeah, Lester, the CDC says the risk is high because the numbers are through the roof. They've given their guidance, but this is a tough choice for many American families. My mom is a cancer survivor. She's within driving distance, but the risk is just too high. We're both going to play it safe and stay home.
Yeah, a lot of families having that conversation tonight. Miguel, thanks.
South Dakota officials reporting 31 new COVID-19 related deaths. As of today, officials have reported 280 deaths since the beginning of this month. The state also announcing 1,071 additional cases earlier today, with nearly 2,400 new recoveries. With those new recoveries, the active case count dropped to under 18,000. Officials say nearly 2,300 people were tested, with nearly 47% of those individuals coming back positive.
Minnesota has set another single-day high in reported COVID-19 deaths. Officials announced 72 virus-related deaths. The previous high was set yesterday with 67. The state announced 7,878 new cases. Minnesota's positivity rate has now risen to 6.9%. Meanwhile, in Iowa, nearly 4,200 new COVID-19 cases were discovered over the past day, along with nearly 1,500 new recoveries. Officials reported 38 new COVID-19 related deaths. The state's active case count sits at 83,782.
With Thanksgiving 1 week from today, U.S. doctors, nurses, and hospital officials are pleading with Americans to scale back holiday gatherings as COVID cases and deaths skyrocket. As Wynn Wilfolk reports, the CDC even recommending people not travel for the holiday this year. That story, new here at 6:30.
With infection rates soaring, the nationwide death toll passing 250,000, and many hospitals reaching capacity, the second COVID wave proving worse than the first.
We're alarmed. With the exponential increase in cases and hospitalizations and deaths.
That alarm prompting the CDC to recommend Americans not travel during this Thanksgiving holiday.
This is a serious point in time in the pandemic, and that we need to be all doubling down on the things that we know work for slowing the spread of COVID-19.
In an open letter to the American people, 3 organizations representing healthcare workers, quote, strongly urge everyone throughout our country to celebrate responsibly in a scaled-back fashion that limits the virus's spread. Despite pandemic fatigue and Thanksgiving 1 week away, no time to let our guard down. But in Utah, the sound of gratitude. This patient, still intubated and unable to speak, played the violin to show appreciation for all of those who've taken care of him. Wendy Wolfoak, NBC News.
Unfortunately, we're going to have to avoid indoor crowded spaces like bars and restaurants, and you're going to have to be very careful even with family gatherings, and that's what Dr. Redfield was talking about today.
What do you say to people who feel like, they've listened to the CDC guidance this whole time? We've seen much more mask wearing than we have ever seen through this whole process, and they feel like they've followed the guidelines, but it's just getting worse. What do you tell them?
So, the guidelines really work. The United Kingdom and France has turned it around with these simple measures and keeping schools and businesses open, not a lockdown. We've done it in Arizona, Florida, Texas, across the Deep South. Really, this is what we need to do. This will turn it around. We only have a few more weeks to do this. If we do this, we'll flatten it. The vaccine will be here. We'll protect the vulnerable.
People have been patient for so long, So then you tell them to stay home for Thanksgiving, these 50 million who are likely to travel.
So I don't think the CDC said that. They recommended that the safest thing to do is to stay home, because there are risks in traveling in buses, trains, in airports.
Sure.
But if you are going to travel, there are some really good suggestions on how to be safer within your home, distancing, masking, hygiene, etc. Please look at the website. Very reasonable, very things. Make better choices.
Admiral Jawar, thank you. Good to see you again, sir. Thanks for being here.
Absolutely. Yes, ma'am.
And also breaking tonight, Dr. Anthony Fauci urging Americans to remain vigilant, saying that a vaccine will be here, quote, soon.
We need to actually double down on the public health measures. If you're fighting a battle and the cavalry's on the way, you don't stop shooting. You keep going until the cavalry gets here, and then you might even want to continue fighting.
Fauci was speaking at the first coronavirus task force briefing since July. August, September, October, November. The first in the White House since Trump lost the election. 4 months since we've had one of those, as you have the 25% surge in deaths in just the past week. The president, though, was nowhere to be seen. More than 250,000 Americans have now lost their lives to coronavirus. Out front now, Dr. Jonathan Reiner, who advised the White House Medical Unit under President George W. Bush. Dr. Reiner, look, you hear people like Gary Cohn saying the big crisis here right now is this surge in the coronavirus, while the president, of course, is spending his time worried about other things. What is your reaction to what we heard from Dr. Fauci today?
Wow, long overdue. The task force meetings before they were canceled months ago had devolved into just basically a long-winded recitation of ventilators constructed and masks delivered. But what they always needed to be was the administration experts, Fauci and Birx, telling the public what they needed to do. And that's what we heard today. We heard an optimistic Tony Fauci telling the American public that help is on the way, but in order to get there, we need to wear masks, we need to social distance and avoid crowded places. So I love that. I love that. It was also interesting to me who wasn't there. Scott Atlas wasn't there. Scott Atlas was only there to parrot the administration's policies before the election, but now, gone.
So, and Scott Atlas, of course, is the one who, said it was okay to not wear masks at the president's rallies, right? He's the one that really has been in the president's ear on this since he joined the task force. Right. Now, the CDC, to your point about, Dr. Fauci giving people a sense of what they can do, the CDC updated its guidelines today, urging Americans not to travel for Thanksgiving. It should seem obvious, but they actually had not formally done it. They say we've seen more than 1 million new cases in the U.S. over the past week. And of course, Admiral Jawar is talking about the 25% surge in the past week in hospitalizations and deaths. But we're only a week away from Thanksgiving now. You had, United at one point saying they needed to have 1,400 more flights. AAA says you've got 50 million people planning on traveling across this country. They've already made their plans. Why did the CDC wait so long to tell people don't do it?
Well, it's hard to ignore the possibility that there was a heavy political hand on the CDC, preventing them from making that kind of statement before the election. And that's when it really should have been made. Look, on the day of the election, we had about 80,000 cases. And the trend was clear. So we knew we were going over 100,000, 150,000 cases a day. The CDC could have said, don't travel on Thanksgiving then, but the administration, that's not the message the administration was trying to make. They were trying to say, we're rounding the corner. And if we're rounding the corner, well, you should be going to grandma's house for Thanksgiving, but that's not what we should be doing. People really should stay home. We'll have a great Thanksgiving next year. I am really optimistic about it. Thanksgiving is just a day on the calendar. We can make Thanksgiving any day we want, but we can't replace people that we care about. So let's protect the people we care about. Stay home this year.
And obviously, holidays have been catalysts for infection jumps. We saw with Memorial Day, July 4th, Labor Day, next week, Thanksgiving, then Christmas, Hanukkah. Is there any doubt that Thanksgiving could end up being a nationwide super spreader event? Even though the CDC issued guidance today telling people not to travel, obviously people are going to travel.
Yeah, I heard that people were buying smaller turkeys, so maybe that means people are gathering in smaller groups. Certainly, I'll be with less family members this Thanksgiving than I'd like to be. And of course, just seeing them on the screen is not quite the same. But, by next Thanksgiving, the vaccine, the great innovation there, will have brought this to an end. So, one more round, probably 6 to 8 months, we're asking people to make sacrifices to save a lot of lives. And then wearing the mask, which I don't consider that much of a sacrifice.
So just to be clear, you personally are having less family at Thanksgiving. You're not going to have what you would normally do, and that's something you would actually recommend for people just from a purely health standpoint?
Absolutely.
We know the guidance is around what we should and shouldn't do when it comes to COVID. We also have friends and families that are more relaxed in their approach to COVID, to say the least, or simply don't abide by recommendations. What's your advice on how people should, go about dealing with that in their lives? I mean, it's just a difficult thing to deal with.
It's awkward when, like the family of your kid's best friend, you're saying, okay, how much should we talk to them about how they're dealing with this? Or how do they ask you, okay, what is your family doing? Because, if you let friends get together at all, then there's a certain disease connectedness that creates some risk. And, I think we have to be pretty aggressive about figuring out, okay, amongst all the indirect contacts I have, are we doing things in a safe way? I mean, literally, there's no part of the country now that hasn't been touched in a pretty big way. And it was predictable that the people who were more lax, that eventually the disease would get there. There was a lot of talk about that. Sadly, it ended up being true, even in towns smaller than I expected it to get to, which it's deeply, deeply unfortunate.
We need to be able to have a good, firm handle on who's infected and who's not. And let me tell you why, Chris. Because right now, what we're seeing throughout the country, that innocent get-togethers of family and friends in a home where people let their guard down because they're with people they're familiar with. We're starting to see those kinds of infections. 8, 10 people get together at a dinner with friends and family. One of them is infected, but with no symptoms. They put their guard down. You're sitting, you're eating, you're drinking, you take your mask off, and that's how we're starting to see infections. I get on the phone and I talk to all of my colleagues around the country. Almost every one of them say that's becoming a very important source of infection. The gathering, the innocent gathering. If you had a test that you could do at home yourself, point of care, sensitive and specific, you could eliminate a lot of that.